forgot to record. Okay. So, Mr. Jacob, his father, Mr. Kinney, admitted yesterday to the hospital with weakness. Sorry, last week. Last week, admitted with weakness. Okay. He was diagnosed as Huntington disease. Please, sorry, your task, you are a senior house officer in the medical department, and your task is to talk to his son, Mr. Jacob Kinney, and answer any concern. Okay, Dr. Aida, you're having a few moments just to prepare the things. Okay, Dr. Aida? Hello? Hello? Dr. Aida, do you hear me? Oh, sorry. Dr. Aida, do you hear me now?
Yes, doctor.
Yes, please, Dr.
I
Aida.
cannot unmute myself. Yes.
Do you hear my voice now? Is it clear now?
Yeah, just now. Yes, yes,
Okay,
yes.
you have 5 minutes to prepare the case.
Okay. Doctor, sorry, my task is to explain to his son he is developed weakness now. This is my task, or
This
I cannot
patient,
understand.
diagnosed as Huntington disease. His father diagnosed as
Newly
Huntington
diagnosed.
disease.
Okay.
Now talk to his son and answer any concern.
Okay.
Dr. Aida, you can hear me? Hello? Doctors, do you hear my voice? Doctors, do you hear my voice? Okay, okay, okay. Thank you. Dr. Aida, you are with us or what? Oh, why you are muted? Okay. Now you are unmuted, Dr. Aida.
Yes, doctor. Yes, doctor.
Okay, go on.
Doctor, just one minute, just sorry.
Okay. Now we exceeded 5 minutes, by the way.
Yes, doctor.
Yes, okay. Go on.
Hello.
Hello?
I'm Dr. Aida, Senior House Officer in Medical Department. I want to confirm I'm speaking to Mr. Jacob.
Yes, that's him.
Are you a son of Mr. Jacob, your father admitted here 1 week ago? It's right?
Yes, doctor, yes.
Yes. We are here together to discuss your father presentation. It's okay for you?
Yes, doctor, it's okay.
Mr. Jacob, do you want anyone to attend our discussion together?
No, doctor, it's okay.
Okay. Mr. Jacob, can you tell me more about your father condition, please?
Well, doctor, my father, he was in a very good health. He was medically free. He was an athlete man, playing football every other day nearly. He doesn't have any problem before, just a little bit numbness, okay. But I was traveling abroad in an area which is isolated from connections, and then 2 days ago, when I went to a place where there is connection, I received a call from one of my friends telling me that my father admitted to the hospital for the last 5 days. I cut everything and I came directly to the hospital. I don't know what's going wrong with him.
Okay. Okay, Mr. Jacob. Really, I'm sorry for that. Mr. Jacob, what's your expectation for your father?
Expectation? I have no expectation. I don't. I want to know what's going wrong with him.
Okay. Mr. Jacob, as you know, your father, it is brought to our hospital. That time, he's complain. That time, he's when he's present, he develop a weakness in his body. Okay.
Okay.
Yes. We received your father and we did all investigation for your father. After full investigation, assessment, examination of father, we get that he has a disease called Huntington disease.
Okay.
This medical term condition affect his the defense mechanism. Yes, and a nerve cable and in whole body. That is why he developed this weakness.
Defensive mechanism. So he is having a weak defensive system.
No, that is no. Sorry for that, Mr. Jacob. This disease affects the nerve cable in his body and muscle, resulting in weakness.
Why, doctor? Due to trauma or what? What happened to him?
I appreciate your concern, Mr. Jacob. This is disease. It is coming from genetic. Genetic, maybe any family history of this same presentation before?
No, doctor.
Any? No, not happened in your family before?
I don't have family, just my father, and my father was adopted. So I don't know. I don't know what's my family. I don't know. I know only my father and my mom, but my mom died long time ago.
Okay, sorry for that, Mr. Jacob. But this is disease run in family, and maybe there is a family history of same conditions. That is why your father now exhibits these symptoms. Okay, and this condition, as I told you, it's affect the nerve cable and all muscle of the body. It is come in different presentation, but your like this presentation now of your father weakness.
Oh, so
So your father need to be seen by many doctors, including yes, nerve doctor and multidisciplinary doctor. As they will give him a proper plan of management. We will do the best for your father.
best of all, doctor, my father now, I had a look at him and I found that he is having weakness. What will you do for him? I couldn't got what is the you told me that he is having a genetic disease or something like this, but I don't know what's going wrong with him.
Yes, I appreciate your concern, Mr. Jacob. This is disease, as I told you, it is a running family. This maybe you have a family history, but maybe you don't know about that. But now your father exhibits this disease. That is why we will develop this weakness. One of the symptoms of this condition. Okay, this disease maybe your father become disabling.
Disabling? What do you mean by that? You mean disabled?
Maybe no, maybe yes. Maybe he cannot. Maybe this weakness. As I told you, it is present in different manner. Okay, but maybe this weakness not resolved because this disease. This is a nature of the condition of this disease.
Is it a cancer, like a cancer, doctor, or what?
I appreciate your concern, Mr. Jacob, but cancer is not present as this manner. It will be in my list, but it need to be excluded. But till now, according to the blood work done and an investigation and genetic analysis, it is appears that your father has a disease called Huntington. It's no cancer.
So you told me that it's on your list, doctor, and you need to exclude. So you are not sure that this is a Huntington disease.
No, it is Huntington disease.
But you told me you will exclude something.
No, sorry for that, Mr. Jacob.
So, okay.
Yes. What do your father doing in his job? I mean,
He is working as a director, and
a director.
yes, he was in a good health. But what I can remember that in the last few months, one of his friends in the job told me that in his job place told me that he had some abnormal behaviors, you know, doctor, some abnormal sexual behaviors with his secretary. I was very ashamed about this, but I couldn't tell him that because, you know, he is my father. I couldn't tell him this.
Yes, yes, sir, Mr. Jacob. This is. I want to ask you. Your father, he's caring of your other member of a family. He's the one responsible. I mean, for them financially and helping. He has anyone rather than you?
No, doctor.
You have brother, I mean sister?
I'm his only son.
You are alone. Okay, I'm sorry for that.
Sorry for what, doctor? I like to be his only son. Why you are sorry for this?
Yes, it's good. It's good. Yes, I appreciate really your feeling, Mr. Jacob. But I mean, I will making meeting with my consultant and to discuss about more about your father life later on.
Okay.
Yes.
So, doctor, what will you do for him? He's suffering now. You told me that he's suffering now. What will you do for him as a doctor?
Your father need to multi-disciplinary team, including brain doctor and physiotherapist. Okay, and need to genetic counseling for you also, because this disease run in family, as I told you.
Okay, so you want to check in the family?
Yes.
Oops.
Need to be screened.
Okay. And then?
Yes. You have any concern?
Yes, I have lots of concerns. Number one, how to treat my father, doctor? Is there a solution for his problem?
Yeah, I'm sorry, Mr. Jacob, because this disease, it is not, it is going progressive. It is not curable because this genetic disease. Okay.
So he will stay in this condition?
I'm sorry for that.
He will stay in this condition?
What?
He will stay in this condition?
Yes, I appreciate your concern, Mr. Jacob, but this disease, the nature of this disease, it is going progressive. It is not resolved like normal, but it is different according to the, it is maybe.
What do you mean by progressive? What do you mean by progressive, doctor?
I mean that is, I'm sorry to tell you that the disease is not resolving. It is not. What?
2 minutes.
What you say?
2 minutes remaining, doctor.
Okay. I mean that your disease will be it will not resolve completely. This is the nature of the disease. It is going progressive weakness because this is affects the muscle and the nerve.
It affects the muscle and the nerves, both of them. So he will suffer more and more, doctor?
I'm sorry to tell you that, Mr. Jacob. It is like that. This is like that.
Okay. Oh my God.
You have any concern? I am sorry for that, Mr. Jacob. I'm sorry. I really appreciate your feeling. I'm so sorry for this hard news for you today.
Yes, doctor. I'm having another concern. I'm having 2 kids. How to deal with them? Should I test them or what?
Your kids? You have 2 kids?
Yes.
Yes, we will refer you and your kids for genetic counseling.
Okay. When you are planning to refer me to this genetic counseling, doctor?
After discuss this with my consultant, I will make appointment for you.
Okay, doctor. Okay.
Any other concern?
No, doctor, thank you.
Thank you.
Okay. 2 minutes for discussion. Okay. What did you do well and what did you do in a bad way in this case, doctor? Hello? Hello? Again? Muted? Okay, 1 second, doctor. I will unmute you. Okay, you are unmuted now, Dr. Aida. Dr. Aida?
Yes, yes, doctor. Yes, doctor.
How was your performance with this case?
It's not good because it's first time for me, doctor.
No, doctor. This is discussion with the examiner. I'm asking you as an examiner
Okay.
now. What was your performance
Okay.
for this case?
I told the patient what I know about his condition.
So
I told whatever I know.
okay, what type of scenario this case you think?
Breaking bad news.
Breaking bad news only? Okay. Did you check understanding for this patient while you were talking?
Yes.
Okay. If so, you think that you were checking understanding with him so much. Okay, doctor. So, did you take permission? Did you ask the patient if he is having permission from his father or no?
No. I forget really.
Okay. What are the conditions that you may break patient confidentiality?
What your question? Sorry.
What are the conditions that you are allowed to break patient confidentiality? Breach or break
Uh,
patient confidentiality?
if the patient is incompetent.
Generally, I'm asking you generally. What are the conditions that you can break patient confidentiality? Okay, doctor.
Like in the case of disease not like if the disease affect other, if I mean the any surrounding can harm from the disease.
What do you mean by this? What is the medical term for this?
Mm,
You mean notifiable diseases, huh?
yeah.
Okay, what
Yes,
else?
yes.
What else? Okay, doctor. Which type the Huntington's disease? I mean, the mode of transmission.
Autosomal dominant.
Okay. What else? What do you know else about it?
It is with variable penetrance. It can appear in generation and disappear in other.
Okay. So when do you think this patient will die? What is the time period? Patients with Huntington disease usually die.
It is short, but I cannot remember exactly what the time. Months,
Sure.
maybe.
Months.
Months, yes.
Okay. So you will refer this patient to genetic counseling, yes?
I'm not sure really, doctor, about that,
But you told
no
that
need, doctor. No need for referring now.
so if it is no need, why did you tell the relative that he should be referred, he and his kids as well?
Yes, yes.
Okay, thank you, Doctor. Thank you, Dr. Aida, for your contribution. I'm sorry, I know that I was silly in this scenario, but you know, if we are trained to be silly, to be under stress, everything will be inshallah good in the exam. Thank you, doctors, for sharing your notes on the chat box. But I'd like you, if you are having comments, we can say the comments by the end, because you know, let every one of us be under stress. Okay. Okay, Dr. Aida, you are unmuted or muted, Dr. Aida. Please be unmuted. I will unmute you again because I have to discuss some things with you in this case. Okay, Dr. Aida, do you hear me?
Yes, yes, doctor. What you
Okay.
say? Sorry, I'm
Please,
not hear you. Sorry, what you say?
please be with me in the explanation. In the explanation, I will tell you what were the things
Okay.
that you make wrong in this case. Number one,
Okay, okay, sure.
which is the most important. Why did you breach patient confidentiality? At the first of instance, you should ask it. You should have asked the patient if he is, sorry, the relative, if he is having permission from his father or no. For sure, you will not ask him, did you have a permission from your father? Because this type of questions carries a bad way in asking questions. So it's better to ask him or her, I believe that Mr. Kinney, your dad, gave you a permission to discuss his condition with you. Is it okay? He will tell you yes. He will not tell you no. Okay, because you came to the exam. If he said no, you shouldn't complete with him. If he said yes, so then you will go to the next. Okay. Number two, number one, you should have asked if he is having permission or no from his father. Okay. Number two, you didn't make rapport with the patient. As we said, it's a simple phrase. Just tell him after making sure that about his ID. Just tell him, I hope that you didn't wait so much for me, or I hope the traffic outside was okay, or I hope that you slept well last night. Any non-medical phrase. Well, this is a medical report with the patient. Okay. Then. This scenario is a combined scenario of a breaking bad news and at the same time explaining a diagnosis. This patient his father had Huntington disease, okay? And he is also at a risk of having Huntington disease, okay? So at the first, when you tell your patient that your father is having Huntington disease, so you have to ask him, did you hear before about this, or you have any idea? He will tell you, yes, doctor, I heard about this from before. One of my friends, his father had the same problem. You know, don't directly jump into explaining the things for the patient. See, doctor, you were doctor-centered during this communication. No, you should be patient-centered. Encourage the patient to talk. Encourage the patient to take his chance in saying things. Okay, don't block him by being talkative all over the station. Okay, you are in the station not to talk only, mainly to listen to the patient. Okay, so your father is having Huntington disease. Do you have any idea about this, or did you hear about this before? No. Okay, I will explain to you now. The second thing, you didn't check for understanding for him, or you maybe checked for understanding one time or two times. You should check understanding every 1 minute or maximally every 1.5 minutes. Okay. If you continue talking for 2 minutes without checking understanding or without letting the patient or the relative to talk, this will be against you. Okay. The other thing, this patient, when he asked you, is it a cancer, you got confused and you told him it's on my list and need to be excluded. See, doctor, the difference between station 2 and station 4, in station 4 starts from the end of station 2. For example, in station 2, you have to diagnose the case, okay? In station 4, you will continue the management plan in details. But in station 2, usually you don't talk, you don't say the management plan in details except for the examiner. Okay. The other thing, Dr. Aida, I'd like you to be more trained on showing sympathy and empathy. Yes, you said it once or twice, but you should mention it so much. I'm sorry, I'm so sorry for this. And please, we are in a film. He is an actor, and me also is an actor. So I have to do like what actors do. I'm so sorry. Try to change your voice tone. Don't be monotonous during the station. I'm so sorry for this. I know that you are suffering. Oh, I'm so sorry. I appreciate this. I see. I appreciate. So sorry for appreciating your concern. Really, and raise your raise your voice a little bit. Lower your voice. Raise your eyebrows. Lower your eyebrows. Okay. Move from side to side like this. Okay, this is a film, and we are actors inside it. Okay. The other thing, when the examiner asked you, what about your performance in this station, you should have told him, actually, this was a hard scenario. Because I had, imagine, tell him that this was a hard scenario. Okay? The patient, the relative came, he doesn't know anything about his father. He knows that his father before he was okay, and all of a sudden he received a call saying that his father admitted. So I faced the problem here. I had to break the bad news for the relative, and at the same time I had to explain to him what's happening and what we need to do in the future for him and for his family. Okay, so let the examiner feel that you were suffering already in convincing the patients with the things, or the relative with the things. Okay? Then we will come, this were my notes for your performance, Dr. Aida. Now come to what we do again, doctors. Doctors, I want you please to write down what can I do if he is adopted not by, okay, doctor, I will come to this. I just explained what were the pitfalls that Dr. Aida made. Okay, doctors. Now, I will ask you, the doctors who attended with us the last few sessions, if we are in a communication scenario, what will you do in the blank paper outside? What will you write? You will write 3 items. What are the items that you should write outside? In the blank paper, you write 3 things. Doctors, you can write on the chat box. What are the 3 things? We said in communication scenario, yes, the issues. What are the issues that you should write outside? Medical, yes, excellent. Medical issue, ethical issue, and legal issue. Excellent, doctors. So in station 4, you have to write these things outside. Okay? You have time. You have 5 minutes nearly, or from 2 to 5 minutes outside the station, so you can write what you want. So the medical issue here is Huntington disease. I have to, is Huntington disease. Okay, so the type of this, and here above you can write here the type of the scenario. The type of my scenario will be a breaking bad news, plus explaining diagnosis for the patient. Okay, then the medical issues here, issue will be Huntington disease. So I should explain him the diagnosis. The ethical issue is the autonomy, beneficence, non-malbeneficence. Okay, and the legal issue here is the confidentiality. I should make sure that this patient, if you found in any scenario a relative, you should put confidentiality as a legal issue. Okay, so when you come to the examiner inside after finishing, he will ask you, what did you find, or what's your performance? You will tell him, okay, sir, so I had actually it was a hard scenario because the patient came from a very far place, and he suddenly knows that his father suffering. I had to convince him. I had to talk to him about his father condition. However, we are having here three issues: medical, ethical, and legal issues. Now the examiner will be impressed. He will understand that you are understanding the things. You are understanding the rules of the game. So you'll tell him, however, we are having three issues here: medical, ethical, and legal issue. The medical issue is explaining diagnosis for the relative about the Huntington disease, and answering any concerns from him, and telling him what will we do, and what will happen with his father in the future. The ethical issue is the autonomy, beneficence, and non-malbeneficence. And before all of this, I should, all of this, I make sure that this son is having permission from his father so as not to breach patient confidentiality. So now the examiner will be impressed, and he will know that you know the things very well. Okay, now come to the Huntington disease. We said before, doctors, how to explain diagnosis for the patient. Doctor, don't try to memorize everything. How to explain diagnosis for the patient is the same way that we are, as physicians, study the diseases. So how we study the diseases? Number one, definition. Number two, etiology. Etiology. Number three, pathophysiology. Okay. Number four, presentation, symptoms and signs. Then complications. Then management plan. The management plan is pharmacological, non-pharmacological, and non-pharmacological may be medical treatment. This is generally okay, or surgical treatment. Sorry, this is the pharmacological. I mean, sorry, the pharmacological you can put under it medical and surgical, and then you can put here follow-up, and lastly prognosis. This is the way that we study any disease, and this is the same way that you will explain to the relative. So you will tell him, I'm sorry to tell you this. So we will bring it from the beginning. We will start it from the beginning. Hello, Mr. Jacob. I'm Dr. Khalid, I'm Dr. Aida, one of the senior house officers in the medical department. Are you Mr. Kenny? Yes, Mr. Kenny, you are a 37-year-old. Yes. Or Mr. Jacob? Yes. Mr. Jacob, you are the next of kin of Mr. Kenny? Yes, doctor. Okay, I hope that you didn't wait so much for me outside or whatever. Mr. Kenny, we are here today to discuss your father's condition. Is it okay with you? Okay. But please, before starting to talk to you, I believe that you are having permission from your father to talk about his condition. Is it right? Yes, doctor. He wanted me to know everything from you. Okay, this is the permission. Okay. What do you know about your father conditions, sorry, before this, do you want any other one to attend this meeting with us? No. And by the way, doctor, you can write these points outside. Don't worry. And if you forgot anything, just look at it inside the station. Don't worry. Then, can you please tell me more? What do you know about your father's condition? Doctor, I don't know anything about him. He was a very intelligent man. He was an athlete. He was playing football every other day. I don't know what happened with him. But to be honest with you, for the last few months, he told me that he's having some numbness, and also I was told that he's having some behavioral changes, some abnormal sexual behavioral changes with his secretary. Then, oh, I'm so sorry for this. Do you hear anything about more than this? No. Okay. you can hear us tell him, okay, Mr. Jacob, what do you all else know? What I know that I received a call and told me that my father had weakness, and then he admitted to the hospital 5 days ago. I just came directly from the airport to here to know what are the things. I had a look at him and I hardly talked with him. Oh, I'm so sorry for this. I deeply appreciate your feeling now. I'm so sorry for what happening to your father. Mr. Jacob, I have a part of bad doctor. See how I am talking. What is the way? Like staccato speech, you know? I am so sorry. This is a film, as I told you, and we are actors inside. I am so sorry for what happened to your father, but I'm sorry to tell you that he is having a condition which is abnormal, or I'm having a part of bad news for you. And then keep silent for 1 second. Look his eyes, keep eye contact all over the conversation. What do you mean, doctor? What's happening? I'm so sorry, he is having a condition called Huntington's disease. Did you hear before about this? Or just keep silent after this. 2 seconds, golden silent. And please don't keep silent for more than 5 seconds, because the surrogate are well trained. If you exceeded 5 seconds in the golden silence, then he will start to be angry. Please, he will shout at you. So just give him from 2 to 5 seconds just to absorb what you said. Huntington's disease. What do you mean, doctor? I'm so sorry for this. Did you hear before about this condition? No. Okay, if you would like, I can explain to you what is this condition. Is it okay with you? Okay. So, and you can withdraw for him. Okay, I will remove these things, doctors. You can look at the board, please. And then tell him, okay, Mr. Jacob, I have to tell you that your father is having this condition. It's called Huntington's disease. You know how this disease happens? We are, as humans, we are having 2 codes in our bodies, or 2 genes. For example, if this is the gene number named A and this is the gene named B, okay, for anything in our body, we should have both genes, E and P, intact. If one of these genes is affected, okay, for example, if this gene is affected, the person who is carrying this affected gene will have the disease, okay? But when he will have the disease, actually, we don't know. How severe it will happen to him, also, we don't know. But what we know that if this bad gene inherited to his offspring, there is 50% of affection of his offspring. So the patient himself having 100% affection of the disease if he's carrying the gene, and if he transmitted the gene down to his offspring, so there is 50% because he may transmit this gene or this gene. Okay, is it okay till now? Is it clear this point before going to the next step? It's okay, doctor. So, what happens in Huntington's disease, Mr. Jacob, is that the abnormalities in this gene or in this code affects the brain and affects the substances which are responsible for transmitting the impulses in our brain, and subsequently will affect the muscles. Usually it starts with behavioral changes like what happened for your father, abnormal sexual behavior or something like this, and then progress down to, may progress to weakness. I'm so sorry while I'm explaining to you this. I know that this is not a good thing, but you know, you have to know the truth, because I'm sure if you know your father's condition well, you will be very supportive to him. I'm sure from this. Okay. Sorry again, Mr. Jacob. Sorry. And then after this, unfortunately, he may have depression at any time. And you know, people, if they have depression, you know, they are at risk of what? Suicide. That's why I should tell you everything, because he will need you. He will need your support. That's why we should tell you everything about his condition and about his disease. Because you know, finally, it ends with stiffness in his muscles, rigidity, I mean, okay? And I'm so sorry to tell you that it leads to death, finally. I'm so sorry for this. You know, Mr. Jacob, which manifestation will appear first, we don't know. But actually, your father had this behavioral change and he had some weakness. Usually, if we discover the disease, usually it have a lifespan of about 17 years, from 10 to 20, median 17 years. Not only months, Doctora. Doctora, if you are not sure about your answer, please don't answer. Say, I don't know to the examiner. He will not kill you. Okay? This is better than telling him wrong answer. Tell him, I don't know. I have to go back to the resources, or I have to go back to my consultant and ask him. They will respect you. They will annotate you as a safe doctor. But if you said wrong information, they will annotate you as unsafe doctor, because you are telling wrong information. Okay. Then now we showed the presentation, and we showed the etiology, the definition, the etiology, the presentation, the complications. Then come to the treatment. Mr. Jacob, I'm so sorry for you. I know that I gave you bucks of bad news, but you know, this disease is untreatable. I'm so sorry for this. And unpreventable if he is carrying the gene or the code already. We cannot do anything. We can just treat him in a supportive way only. But we cannot treat the disease, because you know, this is a gene, part of our body. We cannot change the gene if it is present already. Then he will cry, he will shout, he will be astonished, he will be surprised, he will do anything. But you know, you have to give him tissue, water, anything like this. Then again, we'll after explaining the complications for him, then Mr. Jacob, how do you feel now? I'm so sorry. I feel that you are feeling sad now. I know. I'm so sorry for this. I know that no one can feel what you are feeling now, but don't worry. Me and my team all are beside you. We will not leave you alone, and you will not leave Mr. Jacob alone. All of us will be beside you. Don't worry. If it is okay for you till now, I can continue explaining things to you. Okay? Then, as I told you, he will need support. He will need support from, please doctor, don't use the word multidisciplinary team. You know, the word multidisciplinary team is more to be a medical, it's not a jargon, by the way, but you know, it's a heavy word. Better to use a simple word like we are having a team of healthcare professionals here that they will take care about your father, including nerve doctor, including physiotherapy, including mood doctor, okay, and including psychiatrist if needed. And also we will refer him to the social worker. Okay, we will refer him to the social worker who will come to his home and see what things that can make his life more easy. Okay, this is the way that you will explain to the patient, to the relative, how you will do with his father. Okay, till now, Mr. Jacob, you are okay with me? Do you have any concern for me, Mr. Jacob? before going to the next step. Yes, doctor. You said that it can be transmitted to the offspring. I'm afraid if I'm having the disease, doctor, I want to make sure. Now here, doctor, you made a mistake. You told him, okay, I will refer you to the counseling. The rule in such diseases, which are, if you discover them and they are untreatable, like Huntington disease, better not to do genetic testing. Why? I appreciate you. I will tell you, I'm appreciating your concern, Mr. Jacob, but we can do we can do the testing, but you know, what I recommend to you is that better not to do the test. Why, doctor? Because you know, if you found the test positive, you will be stressed most of your days, and you will keep thinking about when I will be like my father. Imagine, you will be put under stress. So what I recommend to you, not to make the genetic testing. Leave the things like this. If anything happened to you in the future, we can deal with. Because you know, it's not a preventable disease. So if it happened, let it happen. If it happened, and we will be beside you, me and my team also, or any physicians in the kingdom, they will be beside you, don't worry. And we will support you. But what I recommend to you, not to do the testing. No, doctor, I wanted to do the testing. And I want I want to know, doctor, imagine if I'm negative, I will not be stressed. If I'm positive, I will accept. If I'm not negative, I will not be stressed. And also, I want to check to my my kids. Now comes the points here. Now you have to respect his autonomy or his will. Then you have to tell him that's okay. Okay, just tell him that's okay. If you want to be tested, I can arrange the things for you with the genetic testing people. Okay, doctor. So what they will do with me? If it's okay with you, I will refer you to the specialized center in which they do this. Usually, they take 2 samples to ensure the results. And doctor, and the results will come at the same day? No, Mr. Jacob. It takes about from 4 to 6 weeks to come. Okay. Okay, doctor. So I will be busy. So I'd like if you informed me by phone. I'm so sorry to tell you this, but we cannot inform the results to you by phone. It's a confidentiality. All what we can do that we will call you and we will tell you that the results came back, and please come and we will discuss the things with you in the clinic. But we cannot tell you the results by phone because we are not sure. We are not sure if this is you or any other person. Is it okay with you, Mr. Jacob? Yes, doctor. Mr. Jacob, I need to tell you something. It's important, but you have to know it. I'm so sorry for this. You know, incidentally, an issue of non-paternity can arise as a byproduct of the testing. Non-paternity? What do you mean, doctor? I'm so sorry for this, but you know, the genetic testing, when we take the snip from you, not from, I mean from any person, sometimes the test says that this person is not the son of this person. For example, if a person X having Huntington and his son Y is, we send him to the genetic testing, we will test both of them, and then the test may come and say that this is not his father. I'm just telling you everything just to know, okay? Then come to the next point. If the test came positive, it will have an impact on jobs and the mortgages. I will write this word. I will write this word, doctor. If the test is positive, it will have a result on the jobs and mortgages. In Arabic, al-qurud. Okay. Okay, doctors, because these patients will have behavioral changes. Okay, so they should, and also they may have weakness at any time. They may have depression, you know. So they don't give mortgages to such patients. Then come to the pregnancy issue. Now he told you that he is having 2 kids. Ask him, better not to test the kids, and better to because you know if the test came positive to them and they are still kids, they will suffer in thinking what's happening to them, and better to leave them till they reach the age of maturity, which is 18-year-old, and then we can offer them. If they want to be tested, it's okay. If no, it's up to them. Then come to the pregnancy issue. If he wants to have more kids, okay, doctor. Now, doctor, if the test came positive, I need more kids. Okay, we have solution for this. We have solution for this. If the test came positive, we have solution for this. We can choose the sperms that are not carrying that are not carrying the abnormal gene. For example, if this is a normal gene and this is the abnormal gene, okay, and this is a sperm and this is a sperm, we can choose the sperm that does not contain the abnormal gene. Okay, is it okay with you, Mr. Jacob? Yes, doctor, it's okay with me. Okay, Mr. Jacob. Anything you want me to add? Do you have any concern for me? No, doctor, thank you. How are you feeling now, Mr. Jacob? I'm okay, doctor. Okay, Mr. Jacob, I'm so sorry to tell you this, but can you please, to hear this, can you please tell me what did you get from this conversation? Okay, doctor, I know that my father was in a good condition, and then he had this Huntington disease, and then that disease can be transmitted to his sons, and it can be transmitted to me, and better not to be tested, but I want to be tested, and better for my children. Okay, I believe the choice for them when they reach the age of maturity, and is that this disease is not curable disease, just you treat the symptoms, and then you will refer me to team of healthcare professionals. They will help me. Okay, any other concern? No. Mr. Jacob, can I ask you last question, please? Okay. How did you come here today? I came by my car, doctor. Okay. If you are feeling uncomfortable now or you are feeling sad, we can arrange a transportation way to you to take you to your home. It's okay with you. But doctor, when I bought my car, don't worry about this. We'll arrange the things. I will contact the people here in the hospital, and they will park your car in a safe place here in the hospital, and then we will arrange a transportation mean for you. Is it okay for you? Okay. Thank you very much, Mr. Jacob. I had the pleasure to talk to you today. Thank you, doctor. Thank you. Now we finished the scenario. I know that I'm talking so much. You think that I talk about half an hour talking about the case, but because I'm explaining things, doctor, you know, I am the surrogate and I'm the candidate at the same time. Okay. Okay, doctor. I finished. Do you have any question? If you have any questions, doctor, just tell me, because we will finish the session, inshallah, now. Any doctor having any question? Doctors, if you want to unmute yourself, you are allowed to unmute yourself. And if you have any question, just ask me, please.
Hello, sir. I have a question. Like we in this scenario, we have to counsel the Mr. Jacob, who is the son of person with Huntington, Korea, that he should undergo a genetic test for himself, since he is the son and he carries a 50% chance of having the disease. But my question is that you talked about the paternity issue. I mean, won't it be too much if we in a scenario we are first explaining the disease of father and then telling him that you are having 50% chances of the disease, and if, then again another issue that there are chances sometimes that we may get these non-paternity issues. I mean, this is again something very uncomfortable for the surrogate. My question is that won't it be too much information in one session, 14 minutes?
Okay, that's a good point, doctor. But you see, this patient, this relative, sorry, if your patient going to have, for example, a procedure, okay, you have to tell him the complications of this procedure. If you missed one of these complications, which may be serious, you may be blamed, and but if you said it, no one will blame you if you said it, because this is a complication. A byproduct of this, I know that this is uncomfortable, but you have to mention it, because imagine Mr. Jacob now he knows that Mr. Kinney is his father. You send him to the test, and then when he came back to discuss with you, you told him, I'm so sorry to tell you, this is not your father. Imagine how it's heavy on his soul. But when you tell him from the beginning that sometimes non-paternity issue may raise. So if this happened to him, when you will ask him to come back again, it will not be as heavy to him as this. Does it make sense?
Okay, thank you.
Okay,
sir.
okay, thank you, doctor. Next, doctora, what about driving if the patient is having chorea? Need to inform the DVLA. Chorea, I have no idea. I will not answer something I am not sure about it. But you know, doctor, I will tell you something about the DVLA, by the way. See, in the exam, the DVLA is a major issue. But what you should know, at least the basics. I mean, the DVLA in epilepsy and the DVLA after myocardial infarction, okay? Then, if you are not sure about the DVLA should be informed or no, you should tell him, I will go back to my consultant. And if you think, for example, if I were you, Dr. Shafqat, if I were you and this question came to my mind, and tell him, Mr. Jacob, I'm not sure if driving in this condition, if your father, for example, if he is having chorea, I'm not sure if this abnormal movement should be informed, the DVLA or no. So I will go back and I will tell you. So you put the question and you answer. I'm not sure if it causes or no. But to be honest with you, I don't know, and I will go back and ask for this. Don't be shy from this, doctor. And then when the consultant asks you, should you inform the DVLA? I don't know, sir. I'm not sure about this. I have to go back. This is one way. The other way, for example, if you are not sure about the duration of patient with epilepsy and you are not sure whether he should stop driving for 1 month or 6 months or 12 months, just tell him, okay, sir, because the regulations of the DVLA changes maybe every 1 year or something like this, I have to go back to this. But what I am sure from it is I should have informed him not to drive. Okay, now you put yourself outside his playing zone. Okay. When the son asked about genetic testing for himself, he is more than 18-year-old, so we prevent him to undergo testing? Yes, doctor. See, Doctora Priya, I didn't prevent him. I told him I recommend you not to do the test, because if it is positive, you will be stressed all over your life. Imagine, doctor, someone is thinking every other day, when I will have Huntington, when I have Huntington, when I will have Huntington. For sure, he will have depression, for sure. Okay, so better just recommend him. I recommend you not to do it, but if you want, it's okay. Okay, till now it's clear, doctors. This is Isha prayer here, so we have to finish this session. Inshallah, we will meet me not tomorrow, maybe after tomorrow, inshallah. Thank you, doctors, and I will upload this session on the YouTube, inshallah. Assalamu alaikum wa rahmatullah.
Thank you, sir.
Thank you.